Appreciate you being with us. I've got your opinion piece here on fentanyl. You want to kind of tell us what your thoughts are on how we ought to be approaching. First, why don't we start with what fentanyl is and why it's a problem, at least the illegal fentanyl in this country?
So fentanyl is a synthetic opioid, and synthetic just means that it's an opioid that does not require the cultivation of poppies to make. Fentanyl is a wonderful anesthetic drug. I give it to patients I do surgery on practically every day, and I give it to them safely. They do great. But fentanyl is an extremely dangerous drug in the wrong hands and when you don't know what you have, because it's just highly concentrated and it's very powerful. Fentanyl is about 50 to 100 times more powerful than morphine or heroin, and fentanyl has become the prime pollutant in illegal street drugs, and so it's now killing people left and right. About 2/3 of the overdose deaths in America last year were from fentanyl.
And that's somebody, this is not necessarily somebody deliberately giving themselves an overdose. This is somebody not realizing the strength of whatever drug they've got, or not realizing the presence of fentanyl.
Yes, these people are not committing suicide. They are, for whatever reason that they cannot get properly labeled drugs to deal with their condition, they are forced to go out on the street. They buy drugs in a bag with no label from someone who themselves probably doesn't know exactly what's in the bag. They take what they think is their normal dose of heroin or oxycodone or whatever they habitually use, and instead it's fentanyl, and it's 50 times more powerful, and they drop dead. The same thing would happen if a diabetic took 50 times the amount of insulin he's supposed to take.
So, and I jumped into your opinion piece probably too quickly, Dr. McClain. You tell us a little bit about yourself. You're a cardiovascular surgeon?
Yes, sir. I'm a heart surgeon down here in Hattiesburg. Okay.
So you've got a very interesting piece here about the best way, in your view, to deal with it. How, tell us how you think we ought to be dealing with fentanyl, with drugs, with harder drugs in general.
Well, the problem with these drugs is that they're going to kill people when they are distributed unlabeled, unregulated on the street. And the best way, if our first goal here is to decrease harm, decrease deaths, then the best way to do that is to make narcotics available legally, and obviously in a regulated way. We already do that. Fentanyl is a legal drug. It's a prescription drug that I can write a prescription for. Likewise, morphine, Percocet, all these drugs that people are going out and getting on the street, we already have a mechanism in place to distribute them safely under a doctor's care. If people had access to that and they didn't have to go out on the street, there'd be no use for fentanyl for these people. They're not taking fentanyl for the pleasure of it, and they're not trying to commit suicide. They're not looking for fentanyl. But dangerous drugs, you're going to save more lives by legalizing and regulating dangerous drugs than you will by legalizing and regulating, say, marijuana. Nobody dies of marijuana overdoses. They're dying from fentanyl, heroin, etc. We need to treat addiction as a disease. We need to stop throwing people away into jail. We need to take away the stigma. If they had legal access to these drugs, first of all, they wouldn't be dying from fentanyl overdoses that they don't mean to die from. And second, many more of them would walk through the doors of rehabilitation and trying to get better. So if we're going to do better with this, we need to take these things out of the criminal justice realm, put them in the medical realm where they belong, and do less harm.
So, Dr. McClain, what does that look like practically? I mean, if I, would somebody just be able to come and say, I'm sort of curious about taking Percocet recreationally, can I get a prescription? I mean, or what? How would that, practically speaking, what does that look like?
Well, most people who start on something like Percocet don't begin those things recreationally. They start because they got prescribed narcotics for some medical problem. But if somebody is already addicted, and right now they are going out onto the street and paying 500 times the market price of these substances in order to get substances that they can't get legally. So they're committing property crimes to finance this because this is the only way they can afford it. If that person had access to a clinic where he could go and pay peanuts for Percocet or whatever it is, then he's not committing crimes. He's going to get a drug with a label that he knows what it is. He's not going to die. That's cops that aren't getting called to go to someone's house who's dead. That's property crime that he's not committing anymore. And if he's interested in getting off of these drugs, which most of these people, if you gave him an opportunity, would be interested, he's going to have a better chance to do that. And society wins all the way around.
But you're not advocating necessarily for. I mean, the as I make sure I'm understanding you, this is more for people who have already developed a problem, who right now we would be, in a lot of cases, prosecuting pretty significantly. That it'd be more about giving them access to these drugs in a controlled setting, under the supervision of some sort of a physician, with a goal of getting them off. I mean, we're not talking about somebody just coming in and saying, "Hey, I hear opioids are great. Can I take a stab at it?"
No, I don't think that's what anybody's got in mind, and I don't think that's what the reality would be. But anything you can say about opioids in terms of danger, in terms of, well, it doesn't make sense to recreationally get high on opioids, can be said about alcohol. And I can go to a liquor store today and buy enough alcohol to come home tonight and kill myself. And that's okay, because society accepts that. Whereas drugs A, B, and C we frown on, and drugs D, C, and E we don't. And the difference in how we treat these drugs has a lot more to do with that than it does with the actual nature of the drugs.
I guess
if I go to a store and buy whiskey, it was made someplace that we all know where it was because it's got a label on it and a company. I know what's in the bottle. The person who's selling it to me knows that he's selling me something that's legitimate. And nothing's going to happen to me that I'm not planning on. Every drug should be like that, and there would be a lot less death and destruction in this society. 107,000 people died of drug overdoses in America last year. It's insane. We have got to do something different.
Well, there's some smart people like you who have been taking a look at the best way to deal with it, and appreciate your sharing that opinion piece and taking the time to be with us this morning, Dr. McClain. Thank you so much for sharing your views with the audience.
Yeah, thank you for having me.